So this video is intended to show how to take a full set of vitals. So we are going to take pulse, breathing, blood pressure by palp, blood pressure by auscultation, pupillary response, skin, and the pulse oximetry, or known as the SpO2. So we're going to start with a pulse. We're going to go for the radial pulse on a conscious patient. We'll palpate, find the strongest spot, and then I will begin counting. And once I arrive at a number, I will multiply that by 2. So I'm counting the number of beats in 30 seconds and multiplying by 2. Okay, so I got a pulse rate of 45 in 30 seconds, so I multiply that by 2, and we have an actual pulse rate of 90 beats per minute is my rate. And I want to also note the strength. It was strong, and the regularity, and it was regular. So strong and regular. Now I'm going to check breathing. You don't always want to let the patient know that you're doing this, or they won't breathe normally. So typically, I will continue to check the pulse, but what I'm actually checking for is the respiration rate. And I'm watching for inhalation, exhalation as 1, and I will count that as the number of breaths in 30 seconds and multiply by 2. That was 7 breaths in 30 seconds, so I'll multiply by 2, and we have an actual breathing rate of 14 breaths per minute. I'll want to also note the quality, and the quality was regular. I didn't notice that there was any labored breathing, any noisy breathing. The breathing was not shallow, and I'll notice the rhythm, and the rhythm was regular because there was a pattern. So now I'm going to check blood pressure, and I'm going to check blood pressure by palpation. I do not need a stethoscope for that. This is a good chance to get a range, especially in a noisy environment. And it will just initially tell me if the heart is beating hard enough to be able to pump blood throughout the body. I want to place the cuff about an inch above the anacubical fossa, or the inside of the elbow. I want to make sure that it's snug, and I can't fit more than 2 fingers between the cuff and the arm. I'm going to find the pulse at the radial artery, and then I'll begin inflating the cuff. I'll inflate the cuff until I no longer feel the pulse, and then I'll go approximately 30 millimeters of mercury more. Then I'll release the pressure in the cuff. And when I feel the pulse return at the radial artery, which was at 138, I'll record that as the systolic pressure. And because I did not receive a diastolic, we put that over P. So my blood pressure is 138 over P, which indicates I was only able to get a systolic. Typically then, I would wait about 2 minutes until the patient had the feeling back in their hands, and then I would take it by auscultation. Auscultation will also give me a diastolic, and the diastolic tells me how much pressure is inside the artery when the heart is at rest. I'll find the brachial artery, Knowing that by palp she was at 138, and that typically that is 7 to 10 millimeters of mercury lower than it should be, I'm going to pump up to 160. I'll begin to release the pressure. I first heard the pulse through the stethoscope at 144, and I last heard it at 100. So the top number, or systolic, is 144, and the diastolic was 100. Okay, now I'm going to check pupils. And the first thing I'm going to look at is their size. And then I'm going to check their reactivity. So I'll shine a light into her right eye and look for its reaction, which means it should constrict. And then I will actually do it in the right eye again, but look at the left pupil, because the left pupil should constrict when there's a light in the right eye. And then I'll check the left eye and look for constriction, and then check in the right eye as I shine a light into the left to make sure that they have a consensual reflex. And I will record that as the pupils are equal in size and they are reactive to light. So I can record that as PEARL, which is pupils equal and reactive to light. And then I would make note if for some reason they were of unusual size, like extremely dilated or extremely constricted. I'm also going to check the skin, and I'm looking for the color to note any extremes in if the patient is very red, if the patient is very pale or white or ashen, if the patient shows any signs of jaundice. And I note that the skin color is pink. And when I look at skin, I'm not just looking at the skin tone, because everyone has different color skin. I'm looking in areas like the lips, the conjunctiva of the eyes. I'm looking at the palms of the hand. I'm looking at the nail beds. It's the areas where everybody is pink, regardless of what their skin tone is. So when I say the skin is pink, it's because I'm looking in areas that are pink for everybody. I'm also going to check the temperature, and I'm just looking for extremes. So is the patient warm to the touch? Do they seem exceptionally cool or cold to the touch? Or are they extremely hot? If they are very hot or very cold, it would be appropriate to actually check the temperature of the patient. But if there's nothing noteworthy, then we can just put that the patient is warm. And I'm also looking for the condition, which is the amount of hydration in the skin. Are they excessively dry? Are they sweating profusely? Do they just have an all-over moisture or glow to them? Or does the skin appear normal? So in this case, she is warm, she is pink, and the skin is dry, but not excessively dry, as it should be. The last thing I'm going to assess is the pulse oximetry. And as I place this on an index finger, and you want to make sure that the end of the finger lines up with the laser that's on the inside, so you might have to go up or down a little bit until you find that spot. You want to make sure they're at rest and that the hand and the arm are at the level of the heart. And give it just a little bit to adjust. You don't want to go with the first number that it displays. Give it at least 30 seconds to a minute to make sure that it's capturing. You'll know that your pulse oximetry reading, or the amount of oxygen that's bound to the hemoglobin at the periphery of the skin, is accurate if what it gets as a pulse rate is the same thing that you got as a pulse rate. So in this case, it is, and it's showing that she is saturating at 97%. And 97 to 100% is normal for an adult patient. Make sure when I've captured that full set of vitals, again, breathing, pulse, blood pressure by palp, blood pressure by auscultation, pupil, skin, and an SpO2 or pulse oximetry reading that I noted the date, the time in military time, and the patient name. If my patient is unstable, I'll want to recheck those vitals every 5 minutes. If the patient is stable, then I'll recheck those vitals every 15 minutes to look for trending.